Over 16 years ago, we experienced what no parent should experience, which is the loss of a child.
Our daughter, Rebecca Ava, was born July 13, 2006. After she was home for a short bit, she had some alarming symptoms, so we rushed to the ER. And when we got there, we were met with doctors that made us feel that we were being neurotic and overprotective, and she will be fine. And you want to believe them. So we brought her home. And unfortunately, the next morning, she was bleeding from the nose, and my husband had to do CPR. And then we rushed back to the ER, and that's when she was pronounced dead. After she passed away, we learned from an autopsy that she had enteroviral infection. When we started talking to pediatric experts, we learned that ERs aren't all prepared for children, and the entire EMS system, even from the 911 call, it's not set up for children. There's no required ongoing training of pediatrics in ERs. 1 in 5 children go to the ER every year. It's life or death where you take your child, and it shouldn't be that way. But this is preventative. You have a 30% lower risk of your child dying if you take them to a higher pediatric-ready ER.
There was a lot of pain and anguish, and we decided we wanted to make a change to improve healthcare for children, that no parent has to experience what we experienced firsthand. Through a lot of research, hard work, tears, and friends and family and people in the broader community, we were able to start the foundation and really make an impactful change.
Our charity has done great work and has improved training and healthcare for children. 90% of the money raised goes directly to the cause and directly to impacting children's healthcare. We've gotten into over 1,200 hospitals. We train the entire medical staff. We train doctors, nurses, even administrators. We train everyone in the ER setting. I believe that our work has been life-saving, but we've been a Band-Aid. It's a national crisis. I don't think people get that yet.
It's not fair that you don't have the basic needs to meet those children.
To get the appropriate training, supplies, and equipment in every ER for every child is cost efficient. So there's no reason that we shouldn't be helping our sickest, most vulnerable children. We need to band together, all parents and caregivers, to make sure and prevent that tragedies don't happen to other families. So it's time for these regulatory and government agencies to make it happen, and we need to hold them accountable. We actually have a petition on ourbabyfoundation.org to change the emergency medical systems for children throughout America. So our next step is doing this media roundtable so we can get the experts, parents and caregivers together to talk about the need to really make a system-wide change for all pediatric emergency systems in America. Some of the latest research to come out in the last few years ties mortality to pediatric readiness in ERs.
I firmly believe that if Rebecca was seen by pediatric trained doctors, there is no question in my mind, based on thousands of hours of research over the last 17 years, that she would be alive.
We believe that no matter where you take your child, at any ER in America, that they should have their best chance of survival. Nothing I ever do will bring back my daughter, but our pain and our grief is so deep that I don't want any other family to feel this way. And I do believe that the changes necessary to prevent this are attainable, achievable, and are so close to happening, and that's why I keep going.